The retina is like a film that lines the inside of the eye. So one of the problems with the retina is that it's not firmly attached to the wall of the eye. It's on there almost like wallpaper. So
Mm,
there's little proteins and some electrostatic interactions between cells and things that stick the retina to the wall of the eye. And that's really important because the cells that allow you to see, the photoreceptors, need to get nourishment from cells in the wall of the eye.
mm,
Because the retina is thin and fragile, so it's the tissue itself has the consistency of wet tissue paper. It's extremely fragile.
mm,
And yeah, you can get, there's a few different things that can cause it, trauma, changes in the gel inside the eye. There's a few different reasons that a tear can happen. But if a tear in the retina occurs, it allows fluid from inside the eye to get into that layer of almost glue
mm,
sticking the retina down, and it dissolves it away. And
mm,
so, in the same way as if you've got water behind your wallpaper, the retina can strip away from the wall of the eye because its attachments are dissolving away, and the cells that give you vision become damaged in that process. So, a retinal tear, if it's not picked up and treated, can turn into a retinal detachment, which is where the retina's starting to come away. And if the retina that controls the central vision, the macula, is affected by that detachment, then some of the damage to the vision is permanent because when that the macula comes away, even when we put it back on, it doesn't work quite as well as it should. So we really want to get in and treat retinal tears before they turn into detachments. And if we've missed the boat on that, then we definitely want to treat a detachment before the macula becomes involved. And failing that, if the macula is involved, if you have a retinal detachment that involves the macula, the vision is terrible. You can barely even see someone holding up fingers in front of you. But we need to do the operation to put the retina back on because we will get some vision back. Won't be 100%, but it'll be a lot better than it is in that situation. And if we
mm.
don't repair it at all, then the vision in the eye will be lost, and in about 10% of cases, the eye itself can be lost. So we always need to treat a retinal detachment, and we always need to treat a retinal tear that we think is going to turn into a detachment.
Right. So it sounds like speed is the essence then, if there are any retinal tears and detachments. So what are some of the warning signs for patients that they should be aware of so that they actually can take prompt action if they do have a tear or a detachment?
So you're right. Retinal tears and detachments are one of the most urgent things that we see in ophthalmology because they're vision-threatening pathology. The things that give you a bit of a warning sign. So to take a step back, the thing that causes a retinal tear in most patients is a process called posterior vitreous detachment. So if we go back to the eye model here, the vitreous is the gel that sits inside the cavity in the back of the eye. When we're younger, it's attached firmly to the retina. That's where it's got important roles in the formation of the eye in babies. But over the course of your life, it just gently comes away from the retina. That's a normal process. In some patients, it can be stuck a little bit firmly in one location than compared to everywhere else, and that might be a little spot out in the peripheral part of the retina. And so when the vitreous is detaching, if there's one point where it's attached a little bit more firmly, you can pull on that point and pull a tear in the retina. So that's how those tears often start. And so the real trick is that the symptoms that people can get from that gel coming away can be exactly the same as the symptoms of a tear. So that gel coming away from the retina is a normal process. It happens to everyone. Only a small number of people get symptoms from it. Those symptoms are things like flashes of light, almost like a lightning strike going off in your vision, or like someone shining a laser pointer at you. It's just a sudden, brief, very bright flash of light that really seems to only be in one eye. And it'll happen, repeatedly. And it often is more noticeable in dim light. And when the eye moves, that can be a trigger for it. So flashes like that are a concern. New floaters, because when the gel comes away, little bits of it can break off and drift around inside the eye, and that's a floater. But if the retina tears, that can also release blood and pigment from underneath the retina that can have the same appearance as a shadow floating around inside the eye. So, retinal tears, process of posterior vitreous detachment can be very similar. So I say that just so people realize that if they get these symptoms, it doesn't necessarily mean that they're about to have a retinal detachment, that it's possible that it's just harmless, but they still need to get it looked at as soon as they possibly can just so that we can make sure that it's not a tear. Because like we said, if we catch them early, they're very treatable. And, better to be safe than sorry. If it ends up being a posterior vitreous detachment and that's it, great. No one's time is being wasted. The doctor that you see is more than happy that you came in and got that checked on, because, we want to prevent detachments, and we want to, preserve people's vision. So if you have symptoms, you're worried, absolutely not. You're not a hassle to anyone. Just come to us, come to another ophthalmologist, go to your local optometrist. Someone who can have a look at the back of your eye needs to just check and make sure that things are going okay. If you have a retinal tear, that doesn't mean you need a big operation in hospital. In fact, retinal tears can be treated very easily in clinic with laser. So it is a form of surgery. It's laser surgery. It's different from vision correcting laser surgery. This is laser to stick the retina down around the tear, but that's a procedure that can be done in 10 minutes in my office, without you needing to go and have a big operation and have gas in the eye and all this other stuff. So it's another reason I don't want people to think, oh my God, I've got a tear in the retina, I'm scared to go and have an operation. That's actually what we want to pick up, because we can prevent a big operation.
Okay,
Yeah.
that's a good
But
point.
yeah, so yeah, I just want, just so that everyone's clear. I don't want to scare anyone that they need an operation.